Okay, let's go. Back at it here.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum, and this is Back at It with Dr. Decompression.
We're here, Back at It with Dr. Decompression podcast. I'm Dr. Dudum. This is episode 2 of season 2. We are going to talk about disc 101. We're going to talk about the different types of disc injuries. What is the anatomy of the disc? What are symptoms of a disc injury? And what can you do to fix a disc injury? In episode 1, we just talked about trends that I'm seeing every day in this clinic, this decompression clinic. Trends for lower body and trends for upper body, neck and low back. And I mentioned disc bulges and I didn't go into it. Now we're going into it. I'm talking about it right now. If you're listening on the podcast, I'll describe what I'm showing. Sorry for those. If you're watching, you can see what I'm describing. You have 2 bones. In between the 2 bones, there's this disc. The disc is the cushion. It allows us to be flexible and dynamic. Behind the disc, there's the canal where the spinal cord is, and the nerves branch out of each side. That's what we're looking at. The disc material itself, everyone compares, the disc to a jelly-filled donut. It's a very fair comparison. You have an outer shell. The outer shell is cartilage. It's collagen fibers. It's very rubbery, okay? It's elastic, almost like an earlobe or something like that. Inside is called the nucleus pulposus. That's gel, that's the fluid, that's the liquid. The inside is contained of about 60 to 80%, we'll call it 70% water. The outside is called the annular fibers. So you got annular fibers, and the inside is the jelly, like the donut. What happens when there's forces on the spine and the spine's compressed and you move and you're dynamic, but there's certain limitations or muscle imbalances, like I talked about in episode 1, last episode, when you have lower cross syndrome and certain muscles are working, the glutes are not working, you've got the erector spinae muscles in the back, they get over tight, then those small multifidus muscles they stop engaging. There's vectors and forces and shearing that's going on as you move, and that is what leads to a disc bulge. That causes pressure on the disc, and then it kind of gives out. The ligaments don't support it. Boom. You have a disc injury. What are the types of different disc injuries? Well, number 1, okay, if you don't have a sudden event, your disc over time can degenerate. The fluid can wear out and dehydrate, and it just, think of a tire of a car. You're driving, and the tire eventually goes bald. That's kind of what's going to happen with the disc. The fluid's going to wear out, and it's going to be called degenerative disc disease. You're going to be super stiff in the morning. You're going to lack the flexibility that you want. You're not as mobile. Typically, what we're referring to your legs, but that's degenerative disc disease. If you have that, you are more prone to a disc injury. Degenerative disc disease, you're more prone to a disc injury. What are the types of disc injuries? You have a disc bulge. A disc bulge is the most minimal disc injury. That is if we squeeze the donut a little bit, and the jelly of the donut doesn't actually go through the fibers of the donut. So the nucleus is still intact, it's just pushing out a little bit onto the nerves possibly, or the spinal cord possibly. The second is a herniation. Now, there's terms that are used, disc herniation and slipped disc. Very synonymous terms. They mean that the nucleus or the jelly has gone through and broken through the barrier of the fibers. So let's think about this. Let's say I squeeze the jelly, filled donut, and the jelly just starts to ooze a little bit out of the donut. That's a herniation. Disc bulge, disc herniation. What is an extrusion? I've heard this word extrusion before. What is that? An extrusion, being more severe, is when you squeeze the jelly-filled donut and it's a lot comes out. It's big. It's extruding upward or downward. Up or down. Now that usually will hit some nerves, causing leg pain. A disc herniation can cause leg pain, and a disc bulge can cause leg pain. Disc bulge, disc herniation or slip disc, and then you've got disc extrusion. Those are the three main terms. Now, an extrusion is the most severe. That would be the one that you or I are going to, when we have our consult, we're going to say, hey, that's pretty severe. How's the size? Those are the types. Let's talk about the size. In my 13 years of clinical experience, this is how I would categorize the sizes of a lumbar or lower back disc herniation. A smaller bulge is around 0 to 4 millimeters. 0 to 4 is small. 5 to 9 is very substantial. 10 or 1 centimeter and above is, okay, we are going to consult with a surgeon. The risk, we're going to consult with a surgeon. We're going to tread very slowly with this decompression. It's very large. I've helped people, check this out. I've helped people with a 1 millimeter disc bulge to a 1.9 centimeter disc bulge. Doesn't mean I can't help you. It just changes how and the severity of your condition, and if we're mindful of if we're mindful of bringing in other practitioners in case we need it. So those are the size. Location, like real estate term. Location, location, location. It matters where the disc bulge is. You know, the reason for this is there's a lot of research out there. It's pretty clear. 50% of the population that have a disc bulge. So let's say we get 100 people. We do MRIs on 100 people. 100 of them have disc bulges. The research shows that 50% of the people don't even have symptoms. They're asymptomatic. They have no pain, no referring pain. They didn't even know they had a problem. So it's very important. It's a really substantial statistic. It's very important that you don't just, you have to know where the disc bulge is, the size of the disc bulge, and you're not just hunting for disc bulges. Oh, you have disc bulge. You want to correlate that clinically with the symptoms, because you might have an incidental finding of a disc bulge, but that's not actually causing your problem. So you want to be mindful of this type of information when you get an image, like an MRI, you get diagnosed with a disc bulge. We've got to make sure that that is the cause of your problem before we start treating that finding. Super important. Now, on the location of the disc bulges, there's two main areas that the disc will bulge, herniate, or extrude. Number one is the center, so very just straight back. What is in the back? The spinal cord. Or it'll be what's called the posterior lateral, meaning back and side. When it's back and side, it will usually or may occupy the foramen or the hole where the nerve comes out, and that will cause leg pain, leg numbness, tingling, all the way down into the butt, down the side, down the leg. That would be a lateral bulge. If you've got a lateral bulge, the exercises that work very well, if exercises will help you, would be extension-based exercises, like a cobra or like a scorpion. Those type of exercises would be good to try. Again, try the exercises. If they are increasing pain or not helping, discontinue the exercises. The other thing is a central disc bulge. The symptom of a central disc bulge is I'm getting pain coming up off of a chair, sitting down. I have a knife stabbing me in the back, like it's deep, sharp pain is a central bulge. These aren't always true, but they're very good summaries of what may be happening. If you've got a central bulge, you want to do more flexion-based exercises. You want to bring your knees to your chest. You might want to go back and forth. Those would be a good place to start. How does all this happen? How do these disc bulges happen and what's going on here? What makes the discs different than other tissues in the body? Every cell in your body requires some things. One of the things is oxygen. The discs require oxygen. Most of the structures in our body get oxygen through blood supply. Discs, the intervertebral discs, they are one of the few structures in the body, they do not have a pure blood supply. The blood supply stops after about adolescence. There's no blood supply. How does the disc get blood supply later in life? It's a term called imbibition. Imbibition. It means it requires movement. You've got to move. That's why sitting is not good for your discs. It lacks blood supply. You've got to get moving. That movement will allow oxygen and nutrients into the disc. It'll stay hydrated. It'll stay healthy. If you don't move, it'll become stagnant and dehydrated, like a raisin. You want a grape. You don't want a raisin as a disc. So movement helps. That's why things like a cat-cow, where you're flexing and extending the spine, is a great exercise to do every day. It's called spine flossing because it helps floss and regenerate and get movement into the spine. One of the reasons that spinal decompression works so well, it works so well because it gets movement into the disc area and it allows blood supply and healing into the discs. There's a study that was done in 2009. They had 60 patients. 30 of those patients had traditional spinal decompression. 30 got decompression. The other 30 got on the table, but the button was never pushed. It was a placebo. 30 and 30. After 8 weeks of care, 8 or 10 weeks, they did an MRI, a post-MRI. The patients that had the disc, the patients that had the spinal decompression, do you know what happened? Their discs were filled with more fluid. And the space, the disc space, the space where the disc lies, it had more space. The pressure was off of the nerve and it helped their back pain. Well, what about the placebo effect? Maybe they just being on the table would increase that. Didn't change the disc space at all. So when we're pulling with decompression, it's actually getting nutrients into the disc. It's healing the disc and it's decreasing inflammation around the nerve. That's why we do decompression, and that's why it works. Symptoms of disc herniations. Yes, back pain down the leg. We've talked about that. What are everyday things that when I hear from a patient, I think disc bulge? I'm going to tell you that. I'm here to tell you the clinical pearls in 13 years of my experience that's going to help guide you so you don't have to wait and call and get a telehealth appointment, wait 3 months for an appointment when you can't even sleep. That's ridiculous. Here's what you need to know. If you have pain, butt pain or leg pain, when you put your socks on and you lean forward to put your socks on and you're, that really hurts, good chance you have a disc bulge. That's number one. Number two, if you have pain when you cough, sneeze, or when you strain to go to the bathroom, we talked about this in episode 1. When you bear down and you have pain in your back or pain on your leg, you have a disc bulge. That's number 2. Number 3, with prolonged sitting, if you have referring pain in your leg, or prolonged standing and walking, like more than 5 minutes, guys, okay? If you can't walk for more than 5 minutes and you have pain on your leg, you have a disc bulge. Very good chance you have a disc bulge. This reminds me of my story. I talked about my story in season 1. I had a 5 millimeter disc bulge. Now, based on the size, it's smaller but significant, but it's also about the location. My bulge was a posterior lateral bulge, so back and side, right where the hole, where the nerve comes out. Here's the key. My bulge was abutting, it's the term that the radiologist will use. It's abutting and touching on the spinal nerve that exits. So I had an L5-S1 posterior lateral 5 millimeter disc bulge, and it was touching the nerve root. It was a mechanical problem. It was touching it. That was referring pain into my butt. My hip was on fire and pain down my leg into my pinky toe. That's a huge, that's why I wanted to talk about this. A 5 millimeter disc bulge it's big, but it's not 1.5 centimeters. But the location of the disc bulge was in such a crappy spot that it was on my nerve. And that's why I couldn't get relief with chiropractic, red laser therapy, physical. I couldn't get relief with any of that stuff because it was a physical problem. The bulge was abutting the nerve. Physical problems require physical solutions. Think about that. Injecting steroids and anti-inflammatories into a physical problem, it could help. Like, it could reduce the pain or the inflammation, but it's not going to remove the disc bulge. Now, there's another interesting study that showed that 80%, maybe give or take, but around 80% of patients with a disc herniation that are symptomatic, their bulge either reabsorbs or their pain goes away within 3 months. That can happen. That happens. There's studies that show that. Here's the thing. If you can't sleep at night and you're not getting relief, you're not going to wait 3 months to get your disc bulge to reabsorb. That's when you call me, we do decompression, and we get past that faster. Or what if you've had a disc bulge for more than 3 months? Then you really need decompression. Then we really have to do a mechanical fix to your back. Or what if you're getting some relief, but you want to get better faster? If you've never suffered from a disc bulge, it's horrible. It is horrible. I wouldn't wish that on anyone. And to have to wait to see if it gets better, to me, I wouldn't want to do that personally. So yes, for anyone that says a disc bulge can reabsorb on its own, and it will, studies show that it does. But a lot of times it doesn't. And it does it slowly. It doesn't completely reabsorb. There's still inflammation. There's other things going on. So don't wait for it to reabsorb. Don't be like other patients. Be like me. Take action, and let's fix the problem. We can even give you remote exercises to try. Try the exercises that we've given you, they've recommended, see if it helps. But those are the everyday things that you probably have a disc bulge. I'm here to tell you those everyday things. So that's disc 101. We've talked about the anatomy of the disc. Why is the disc important? We talked about how does it affect the nerves. We talked about what exercises can you do based on the location of the disc bulge. We talked about the size of the disc bulge. Size matters. Location matters. We're going to talk next week. Our new studio for season 2 allows guests in our office. We're doing guests in the office, and we're doing remote guests. We're going to have a guest on the podcast. I'm super excited for the guest. I want to thank again our sponsors, Pillowise USA and Power Plate. Big contributors to the podcast and big contributors to helping patients in our office, which is the most important thing. So thank you. Thank you for listening. Don't forget to hit the follow button. This is Dr. Dudum. This is the Back at It with Dr. Decompression podcast. Thanks for listening.